Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Hello.
Hi, hello.
How are you?
I am good, thank you. How are you?
I'm good, doing well. It's been so long since we've connected.
Yes, yes.
Yeah,
I like you seeing growing and glowing since the time we last met. You had come to me for your dental treatment, and then
yeah,
I've seen you growing and glowing from
thank,
there on. Yes.
thank
Very
you.
nice to see you.
I was just about to say it's almost been like a year since I came to see you for my dental cleaning and just suggestions, recommendations, and um, yeah, it's been 1 year, and I'm so happy that I'm able to connect to you on a platform that unites everyone in healthcare system, and it's so awesome to talk to you like this.
I am also glad to be here, be a part of your podcast.
Thank you so much for joining me today. And I'm so happy that we have a dentist here in this family now who is able to talk and who has, like, I know I follow your work so much and I love it. Congratulations, first of all, on your new clinic and your new
Thank you,
setup.
thank
It's in
you.
Pimpri, right?
No, it's in South Pune, NIVM.
Oh, it's an IBM.
It's an NIVM. Yes.
That's
Developing
awesome.
area. Yes.
Yeah, that's really good. So congratulations on that, and
Thank you,
many more things to come.
thank you.
Okay, let's dive in. So today's session here is with Dr. Monica Mulchandani, and she is a dentist, and she's been working for a very long time in this field. You have a lot of specialization, and I love the fact that you're so open to what's next in dental health and what's next. So I love the fact, and thank you for sharing that today with all of us. So let me start by asking you my favorite question. What is health?
Yeah, so health is a combination of physical, mental, and emotional well-being.
Right.
Now, besides just the biological factors in good shape, now as we grow as a person, we add multiple dimensions in our life, be it family life, social life, professional life. And once our self-awareness increases, we tend to get involved in spirituality. So how is our equation with all of these factors also decides a lot about health. So it's primarily combination of all of these factors. And being a
Right.
dentist, I would also like to mention a lot of our health starts here. We
Yes.
we have microbes like good bacteria, bad bacteria, which is known as microbiome. So when a child is born, the microbiome which is first to get started, which is first to get populated is our oral microbiome.
Oh,
And this then goes to our gut. And we all know, most of us know gut is a superpower. 80% of our immunity is in our gut.
yes.
So it starts from here and later it soon progresses elsewhere in the body.
I did not know that. That's so cool to know that it all
Yeah.
starts. And you're representing dental health. So I'm glad that you told me about it. I was not aware about. I knew the good bacteria, bad bacteria. There's so much to learn. There's so
Right.
much to learn.
It's all connected. Yes.
It's all connected. Yeah, like I
Yeah.
always tell my patients, it's one body. You cannot be just saying that, okay, my back pain is not going away if you're just treating the back and not focusing on breathing
Right.
or not focusing on those other stress factors that are causing or affecting you.
Right.
So it's one body, and I'm
Yes. It's all
glad that
interconnected.
it's all interconnected.
Right.
I'm glad that you take care of the main part that I'm super scared about, the oral health, and it's just super scary sometimes. So you mentioned about the spiritual aspect. Does that, like, I don't know, I'm very curious to know, does that affect the oral health as well?
No, I mentioned about oral health as a factor
Right,
involved in health,
right.
right? Spirituality makes us more self-aware, as in we dive deeper. How is our equation with ourselves? That's more about mental health, spirituality. Yes, it helps us figure out what do we actually want in life, what is our purpose in life. And once we get aligned to that, life starts becoming better, more purposeful, more beautiful.
And self-awareness will help take care of yourself better.
Yes.
So,
yes.
True. Tell me, how did you start into, how was your journey of starting in dental school and you wanted to be a dentist?
Honestly speaking, I wanted to be a cardiologist. That was in my mind. Yes. So I was more inclined towards medicine as such, the biology, medicine. And I was always more interested in all of studying about normal physiology of body. I used to read a lot about it. That was always there. Then I actually was a student who had taken both PCM and B, maths and biology. I loved physics, I loved biology. I was also good at maths. So my brother was actually an engineer, and I actually was trying to follow his footsteps. I was admitted in engineering college. And then later, but that was like, we are 18 years of age. I wasn't very self-aware, as I wasn't making my decisions with respect to my heart. That's a lesson I would also tell to my 18-year-old, to follow my heart always. So then I realized, no, I'm more inclined towards this aspect, biology and normal physiology of body. Then I applied for this counseling. My options were there. I was getting MBBS, but I wanted to be either in Pune or Bombay. And that's how I got dentistry. By second year, I realized dentistry is a blessing in disguise because it's more of an art. It's an art and then science. Dentistry is more of skill. It's art. And I always loved physics. Physics is also a great part of dentistry.
Oh, wow.
And yes, physics is a great part of dentistry. More than biology, I see more of physics in dentistry. That's there. And with time, I've also come to realize the love for normal physiology of body and body overall is still present in dentistry. A functional aspect of dentistry has come up. Functional dentistry. Not everybody is practicing dentistry with respect to this point of view,
right?
But it's soon going to be the future. Functional dentistry. It's a part of functional medicine. Yeah, where we assess a person as a whole, how oral cavity is connected to our systemic.
Can you elaborate more on functional dentistry? It's a very new term that I've come across, and I haven't heard anyone speak about functional dentistry.
See, traditional dentistry is good. It's very useful. In fact, being a prosthodontist, it's still my passion, being a prosthodontist, treating patients and rehabilitating them. Traditional dentistry is based on principles of medicine and surgery, wherein a patient comes to us with a cavity, a decay, we remove it and then we treat it. If there's a defect, we surgically treat it. Right. This is primarily based on principles of medicine and surgery. Right. Now, functional dentistry is considering body as a whole and not considering oral cavity separately. We tend to evaluate patients overall. How is their breathing? How is their posture at rest? How is their, are they sleeping well? Now, there are many systemic diseases, primarily those chronic inflammatory diseases, which tend to show their first signs and symptoms in oral cavity. So a dentist can also be the first person to actually tell the risk factors or to tell patient to get tested if there might be some presence of systemic conditions.
Wow. Yeah.
Right. So functional dentistry is primarily looking at the root cause, what actually initiated decay. Now, earlier, dental decay used to be primarily, the cause of dental cavities was primarily sugar, acid decay, lot of carbs, sugar, the bacteria which are feeding on sugar, creating acidic environment, and then they are decaying the dental structure, leading to cavities. That's still there. Now, if we tend to look at patients who are coming with multiple cavities, if we just treat the decay, drill and fill, it's not going to stop there. We need to educate patient. Why is this happening at first place? We need to look at the dietary factors as well. Now, dental tissues, the enamel and dentine, these are even harder than bone. Dental disease can also be considered a type of skeletal disease wherein we need to figure out whether the patient is having good quality diet, very rich in fat soluble vitamins, A, D, and K2 primarily. How is the growth of jaw? All these vitamins, growth factors affect the growth of jaw as well. The quality of dental tissue, whether they are well mineralized. If a tissue is not well mineralized, it tends to decay at faster rate. It tends to be softer. So we try to go back to the root cause by figuring out how is their diet, how is their lifestyle, how is their breathing, a lot of factors.
So that's functional. Do you think functional dentistry is the next step in dental health?
It already is, because it already is. Just that not many are practicing it. It's soon going to proliferate. Yes.
How are different ways to educate people about functional dentistry? Like you mentioned, diet plays a role, sleep plays a role.
Right.
There are so many other things that we are not aware about as a common man, and we tend to do those things. How can we do it or not do it? How would you approach a cavity as a whole in a person's body?
See, we actually start by educating right from an infant stage. We can educate parents, as in parents, how is digestive health of parent, how is gut health of parent is primary determinant of how will be the quality of microbes in parent's breast milk. Those microbes come into oral cavity of infant. Those infants' oral cavity gets populated and those microbes move into gut. Gut is a primary immune system, 80% of our immune system. So right by educating parent and then kids, for kids, we can actually educate parents what are the essential factors for proper growth of their jaws. Again, dietary factors and lifestyle. We tend to educate parents to observe their child if they while they're sleeping. Are they sleeping well? Are they mouth breathing? Are they grinding their teeth? Are they snoring? So we can mention symptoms. With these symptoms, primarily patients comes to a dentist with these symptoms. I'm grinding my teeth. Grinding of teeth can not just be a tooth-related factor. Most often, it tends to be most often sleep-related or something something like resistance in the upper airway tract can also be a factor into teeth grinding. So we need to assess. A functional dentist primarily assesses a patient completely, as in there is complete airway centric assessment. There is assessment about their gut health. There's assessment about their sleeping. So the way by educating them, by looking at the symptoms cannot just be dental symptoms. Like I mentioned, right from observing whether your nasal breathing is very important. If the child is not nose breathing, he's definitely mouth breathing. Now, by mouth breathing, what happens is our parasympathetic nervous system isn't active. When we are closing our mouth, when our lips are sealed, our normal posture, a normal oral rest posture is when we are nose breathing, our mouth is closed, our lips are completely sealed, our tongue is touching palate. Now, when our tongue is touching palate, what's happening is our parasympathetic nervous system gets activated. Now, parasympathetic nervous system is rest and digestive system. You get better digestion, you get rest, you sleep well. Now, when this pathway is bypassed, as in when tongue is not touching palate, tongue is lowered, a person is mouth breathing, person is not breathing from nose, person is mouth breathing, his tongue is not touching palate. So the parasympathetic nervous system doesn't get activated. We have a vagus nerve at back of our throat that needs to be activated. That gets activated only if we swallow well, only if we are not a mouth breather, as in our tongue is contacting palate. So the system is getting bypassed and we are not getting the benefits of sleeping well. And the child tends to be irritable during daytime drowsiness, and a lot of teeth grinding. When we are mouth breathing, the tongue tends to fall back. The tongue tends to fall back due to reduced size of oral cavity. And once it falls back, involuntarily, as a compensation, the child tends to take the jaw forward. And that's again invites grinding. So we need to figure out the root cause. What is actually happening that the person is grinding? A traditional dentists tend to overprescribe splints, night guards. That too is important. important. That too is important. That prevents a progression of damage. But we first need to go to the root cause and then start treating accordingly. Yeah.
Right. I mean, my mind is blown right now because there are so many things that I could relate. Starting with patient education, yes, we used to write in exams. I always say, we first point we used to write while writing our exams is patient education, and then start our answers. But we never took it seriously out of theory. But now that since I'm practicing here, I understand how important patient education is. Just to
Right.
sit down and explain to them, and people are open to talking. We just need to explain to them what's right and what's going on actually in their body. So they will listen to you. So patient education is very important. The second thing, like you said, the sympathetic, parasympathetic, that plays such a big role. The
Yes.
fight and flight, the rest and digest, it's such a big role. The clenching, I have one patient, she's a very recent patient. She has had a shift in her jaw since 10 years. Her x-rays are normal, everything is normal, but there's always been like a shift since the very start. And she told me, I was sitting down, I'm trying to figure out what's going on, why, how. I like to do that. I'd like to sit down and know the root cause of things. So she told me that she had anxiety issues since the very
Hmm.
start. And because of those
Again,
anxiety,
anxiety issues are very common in teeth grinders because the
yes,
sympathetic system is always active.
yes.
Yes, parasympathetic system is not getting activated. Yes, it's very
Correct. So
common in
that's what she
anxiety.
told me, that she started, like, she had anxiety since she was like a little kid, and that caused her grinding of her teeth like to another level, that she's just grinding, and it was more dominant on her dominant side. So it just kind of kept shifting, and it just shifted a little further every time. So she has a little bit of shift. She's about to get a MRI done and see what's actually causing what's going on. But they suggested her to come see PT, like do PT, and we've been doing well with her progress. Like I gave her a few exercise. I told her again, like you said, treat body as a whole.
Hmm.
I tried to sit her down, talk her through breathing exercises, then do other things. I also noticed she had a lot of tension in her neck
Shoulders,
and
neck,
shoulder.
back. Yes,
So
right, right.
I was just trying, I started treating other things that I'm good at, like as a PT. I started approaching it like a whole. And it's like now she has a shift only when she has to open it like really wide and unknowingly, because it's a very chronic injury. It's 10 years. But normally if she's aware about it, her jaw drops neutral.
Oh,
There's no shift.
okay.
So it's getting better, but I make her work out a lot. That causes a lot of fatigue in her muscles, but it's helping her, so we're doing it. And that what you said makes so much more sense uh, about just breathing and treating body as a whole. So I'm
Right.
glad.
Airway centric assessment by a functional dentist plays a important role in treating these patients, especially long term grinders or some patients who are not comfortable, who have tensed, like you mentioned, jaw muscles, neck, back muscles, and even shoulders. Yes.
Yeah. What misconceptions do you come across while treating patients?
Common misconceptions I would mention is a lot of patients feel, you're in India, we tend to observe that a lot.
Yeah.
Scaling is a procedure wherein we ultrasonically clean tooth surfaces.
Right.
Scaling makes our teeth loose. That's the biggest misconception I have been commonly seeing since I've
Right.
opened my practice. Yeah, that's not actually making it loose. Ultrasonic vibrations cannot actually remove the tooth structure, which is the hardest structure in
Mm-hmm.
our body. It's actually removing the hard deposits, which known as starter deposits, calculus. We are
Yeah.
removing those.
Right.
And then the space which was occupied by those starter deposits is now clean. You have healthy, you now establish a healthy oral microbiome
Yeah.
once the teeth are clean. But then this is common misconception. Patients tend to feel we felt our teeth were very tight. Now it appears to be loose. This is one of the misconception. And yes, and a lot of people don't know the difference between a scaling, teeth cleaning, and teeth bleaching.
Right.
Few patients tend to expect after teeth cleaning, the teeth will actually start becoming, as in they'll start shining, glowing, brighter. That's actually something that's done by bleaching treatment.
Right.
Yes, that's another misconception.
I remember you mentioned that our natural teeth color is not exactly white.
Right.
It's a little bit of like subtle yellow. And that's normal, that's healthy. That's how healthy teeth should
Right.
look like. So why the misconception of having like super white teeth?
The color is actually variable
Right.
as per age and even a lot of racial factors as well. It's variable. Now, tooth has three layers. The outermost is enamel, which is translucent and it's whiter in color. The
Okay.
inner one is dentine, which is yellower in color. Now, as we age, as we brush our teeth, we are gradually wearing off our outer layer, which is enamel, which is whiter in color. So the whiter layer is becoming thinner and thinner with time. So inner layer, which is yellower, gets reflected from that thinner, whiter layer. So with time, with age, teeth start appearing yellow.
Okay.
So this is natural change. And
Yeah.
what we do in whitening is we are actually treating the color molecules which have stained tooth by bleaching agents. Those bleaching agents are strong and they break them. But again, bleaching is a temporary process.
Yeah.
Yes, and it's also dependent on a lot of our dietary factors like tea, coffee consumption, smoking, wine consumption, berries, all of these tend to stain our teeth. How well is patient's lifestyle? How are they consuming them in moderation? Are they rinsing them out after having these things? So again, bleaching is temporary. It can last up to 4 to 6 months. It's not a permanent result. And it's a lot dependent on patient's lifestyle as well. Yes.
The factors that you mentioned, like smoking, consumption of alcohol, I see that with smoking, there's a change in the lip color, the nail color.
Right.
Talking how body effects. Does it affect the teeth as well? The teeth and the gum?
Right, right. Teeth, yes, they do get stained by smoking, especially the inner surface of upper teeth. Again, in smokers, overall, the immunity is less. The resistance to fighting infection is less. They are more prone to gum infections. They are more prone to bone loss. So for smokers, their overall health is actually, the body turns into a chronic inflammation by smoking. So first signs of inflammation, chronic inflammation, again, are seen in oral cavity. As in we see generalized gum disease, progressing to generalized bone disease. That's what we call periodontitis. Then even there is poor wound healing with respect to this happen in such patients. Yes. So smoking can be one of the factor which affects overall health, and earlier symptoms are seen in oral cavity again. That's the local area of action also.
Do you think, like what you mentioned about bleaching? I've heard a lot over here because I started from here, the dental insurance works different. So when I wanted some cleaning and I wanted to go see the dentist, I had to do the insurance thing, the whole process. So you remember I even spoke to you about it last year or so when I was going through a lot of dental issues. So I realized I was just reading a lot about what are the procedures, what all insurance covers. So it keeps mentioning teeth whitening. So what's the difference between teeth? Is it the same as teeth bleaching and teeth whitening? And
Yes.
how often people should they do it to begin with? How often, if they should do it?
Right. So if a person is opting for, see, bleaching is completely an aesthetic treatment. It's not something which is giving you function of any sort. But yes, whatever keeps you happy, we tend to do it.
Yeah.
Do that. Yes. So bleaching, people tend to do it, but the first thing a dentist makes sure is oral cavity is not having any kind of active infection. As in, all the decays are treated, all the decays are restored with fillings. Now, bleaching only acts, that is whitening. Whitening is same as tooth bleaching. Bleaching only acts on normal tooth surface. It doesn't act on multiple fillings or crowns and bridges which would be already present into patient's mouth. Those surfaces are different. Those could either be metal, ceramic, or filling could be composite resins. Bleaching material won't act on those materials. So if a patient has multiple fillings and if he's undergoing bleaching, the effect won't be in symmetry. Effect won't be in symmetry. It just treats the normal tooth surface. They can get the fillings changed to the color they desire, but effect won't be symmetric. Yeah, so you asked me how often it can be done. The effect, now there are various ways of bleaching. One is in-office bleaching and one is at-home bleaching.
Okay.
In bleaching, what we are doing is we are using a gel, which is primarily either carbamide peroxide. It's a peroxide which releases nascent oxygen, and then it breaks those stain molecules. The tooth gets bleached and it becomes whiter. Now, the concentration of this peroxides is higher in the gels which are done at clinic. Now, this has to be done completely under supervision of dentist because the concentration is higher. We need to protect gum tissues, all the sensitive areas of mouth, so that portion, the gum tissue which is sensitive, that shouldn't be touched by the bleaching gel. Otherwise, it will burn and there might be issues. So this is in-office bleaching, wherein a dentist will apply bleaching agent at higher concentration. For like now there are some light assisted bleaching options available, like zoom whitening, which is very commonly used, light assisted. We are actually using light to activate that bleaching agent which is applied onto tooth surface.
The purple blue light.
Yes. We are using light to activate it. The bleaching agent has a component which gets activated by light, and then that's done for like 10 minutes. So it depends on the manufacturer's instructions, 10 or 15 minutes, and then it's done. The effect can last for up to 4 to 6 months. The person can opt for bleaching like twice a year if need be, if they are high on aesthetic demands. Otherwise, it's a lot dependent on a lifestyle, actually. Like I mentioned, whatever food we are eating, the drinks we are consuming, are we rinsing after eating? Yes. And at home bleaching. Sorry.
Please continue.
Yeah, and the second option is at home bleaching. The agents which are peroxides are at lower concentration since the patient is directly using them at home. The effect isn't great, but it can be used as for maintenance of the bleaching effect which has already been achieved at office. Yes, that's at home bleaching kit available.
Right. So people don't need supervision and they can do it on their own, because
no, it's still to be under the dentist only provides them a kit. The trays are custom fabricated by a dentist. The dentist advises the concentration of the bleach. There are still in market, there are a lot of options available, but it's always wise to do it under dentist supervision because they know which concentrations will work best for your case. Again, in not all cases can be treated by bleaching. Patients who have sensitive teeth, worn out enamel, they cannot be treated by bleaching. Otherwise, there'll be a lot of sensitivity later on. Yes.
Right. Talking about sensitivity, a lot of people are too sensitive to too hot or too cold. How do you approach those cases, and what would you say or what would you tell your patients to do or not to do?
Right. Now, there can be multiple factors for sensitivity. It could either be simply wear of enamel. Now, people tend to brush their teeth very harshly. They have this concept in their mind, like how we wash our vessels, they're actually literally brushing their teeth. Brushing is supposed to be a very gentle process. It's supposed to be teeth cleaning, like how we paint the stroke, the bristles, strokes, that much amount of force. Yes, it's supposed to be very gentle. People tend to brush their teeth very hard. They are using wrong kind of bristles, medium or hard. I'll tell you what all are the better options for good oral health.
Yes.
If a person is brushing very harshly, their enamel layer tends to wear off. The second layer, which is dentine, is sensitive. Dentine is sensitive. So that could be one of the reasons that the tooth is worn out by lot of abrasion. Toothbrush abrasion, and that could be one of the reasons for sensitivity. Another reason could be because their gums have receded. Now, tooth has a portion known as crown, which is visible in our oral cavity, and a portion known as root, which is embedded inside the bone. Now, once the gums have receded, cementum, which is the outermost covering of root of your tooth, gets exposed. Again, that can invite sensitivity. Another reason could be simple decay, a cavity, which a patient has not paid attention to. It starts hurting them. It becomes sensitive, pain to sensations to hot, cold, and they should actually then report to a dentist. Any of these conditions, they should visit their dentist as soon as possible to get treated.
How would you treat them?
Right. So if it's a cavity, firstly, patient education, look at their lifestyle, dietary factors. That would be the first thing. If it's a cavity, we need to assess how deep it is. If it's within dentine layer, we tend to restore it with dental materials. If it's deep inside, as in it has involved the third layer of tooth, which is known as dental pulp, where the nerve and blood vessels of tooth are present, then there's a procedure known as root canal treatment.
Yes.
And yes, and certain cases we also tend to prescribe anti-sensitivity toothpaste. The primary component one should look for is known as potassium nitrate. This actually blocks the dentinal tubules, so the sensitivity is greatly reduced. So patient education, and then looking at the local factors, how deep the decay is, treatment according to that.
Okay, got it.
Yeah.
So that's how you would approach being a dentist. Sensitivity, basically. Is there any food to avoid? Like sometimes you suggest to have ice cream, sometimes you ask the patients to avoid too cold or some too hot tea, because in India
Yes,
tend
there are
to have
certain
hot.
there are certain people who have this habit of consuming lemon water every day. It's good for health. Lemon water is actually alkaline for our stomach. It's good for health. But then again, if you're consuming it regularly, from a dental perspective, I would recommend not consuming it directly by glass. When you're consuming the liquid in glass directly, consistently, you are actually increasing the contact of that acidic lemon water with your teeth surface. So they wear off gradually if you are doing consistently. So you can rather use straw to have these drinks, or you limit them. You have them in moderation, or you can use a straw. Once you are sipping on those liquids with straw, it's not having great contact with your upper teeth or even lower teeth. It's directly going into your system. So the amount of exposure of this acidic media on teeth surface reduces greatly. That could be a solution. And you asked me anything to avoid in specific. That's related if decay has reached to pulpal level, as in the third layer of tooth. We tell patients to avoid eating hot, cold, sweet, sour till the time we start their treatment and remove the focus of infection. Till that time, not like ever, or that particular time. Yes.
Okay. So it's just not forever.
No.
Because I heard
It's
people.
just so that it shouldn't exacerbate the symptoms which are already present. That's all.
I used to hear people saying that itni garam chai mat piyo, or don't have too cold ice cream. Just let it get a little warm, or because you're too sensitive to it. But
this advice is generally given by people who already have an experience of sensitive teeth, right?
Right. Yeah.
Right. A healthy person who is doing well won't have figured out, won't have this idea as in I shouldn't enjoy these delicacies of life. No, only a person who has sensitive teeth would have these issues, and they might feel no, it's not advisable for
Right.
rest of them as well.
Yes, we lost you there for a second, but the network is good. So yes, I agree with you. Those people who are always like they themselves are going through those sensitive issues are the ones to advise.
Right.
Yeah. Are there any tips or tricks that you would suggest for healthy dental health?
Yes, few absolute basics, as in these are non-negotiables, like brushing twice a day. And brushing again, it should be for at least 2 minutes because you have so many teeth. at least 28 or 32 teeth, whatever the number be in each one's oral cavity. So brushing twice a day for 2 minutes with a fluoridated toothpaste. Now there's little controversy about fluoride right now. So you can either opt for a fluoride-based toothpaste or a nano-hydroxyapatite-based toothpaste. Both are good.
Yes.
And with brushing, we are actually cleaning the biting surface of teeth, the side surfaces of teeth. We are not actually cleaning the surfaces of teeth which are touching each other. Those are known as interdental surfaces of teeth. So the second step comes, that's flossing. Flossing is primarily for interdental teeth surfaces, that is between teeth. This surface cannot be cleaned well just by brushing. So flossing isn't an option, it's a non-negotiable, it's required. The interdental teeth surfaces accounts for at least 35% of total tooth surface areas. So if you're not flossing at least once a day, you're not cleaning that surfaces, and that might again invite cavity. Then another third absolute basic is tongue scraping. This is again underappreciated. Yes, tongue scraping. Yes, very underappreciated, but it has a lot of benefits. Like I mentioned in the beginning, oral microbiome. Now, when do we call our oral microbiome healthy? When the population of good bacteria is more than the bad bacteria.
Right.
If you're not scraping a tongue well, tongue is made up of a lot of papillae overall on its dorsal surface. If you're not cleaning a tongue well, beneath those papillae lies a lot of anaerobic microbes. They need to be removed. There needs to be some kind of mechanical cleansing, so the balance in the oral microbiome is there.
Yeah.
Because this oral microbiome have a very important systemic function as well, that is synthesis of nitric oxide. Now, nitric oxide is a vasodilator. Nitric oxide is a vasodilator.
Right.
Especially in elderly, there are various pathways in which nitric oxide is generated. This is one such pathway. There is one nasal immune system pathway as well, where the nitric oxide is generated. But in elderly, a lot of factors like tongue scraping actually helps in prevention of increase in BP. As in this nitric oxide being a vasodilator, it will dilate blood vessels, and the risk factors of increase in peripheral resistance reduces, it being vasodilator. So these organisms can do their job well if the population is good. Again, dietary factors play an important role. What kind of diet? Yeah, another advice is dietary factors. Diet should be rich in vitamins like A, D, K2, and it should be good in probiotics and prebiotics, primarily for healthy microbes. Now, when I mention probiotic, it includes your yogurt, kimchi, sauerkraut. Prebiotics is your fiber-rich food. So prebiotics is actually good for probiotics. Probiotics are your good bacteria, good bugs. So when they are in balance, the system as a whole functions well. So three absolute basics that I would mention is brushing twice a day for 2 minutes, flossing at least once a day, and tongue scraping once a day. Mouthwash is completely optional.
Yeah. Okay. The bristles that you were mentioning about the toothbrush, how would you choose that?
Yeah, when we buy a toothbrush, on the packet behind, it's written soft, medium, hard. Soft is usually recommended.
Okay.
Medium bristle can still be used if the person is very gentle brusher.
Right.
If a person is aggressive brusher, definitely not medium bristle. And hard bristles should not be there in market only. They are very abrasive. So either soft or medium. Medium only if you are a gentle brusher. If your manual dexterity isn't good enough, you can go ahead with medium. Soft bristle is commonly recommended toothbrush. And again, now electric toothbrushes have come up, right? Electric toothbrushes, if the technique is good, electric toothbrushes are superior to manual toothbrush. But again, if the technique is good. If you are doing manual brushing with good technique, I'm going to tell you the technique as well, then it doesn't make great difference between if you are an electric toothbrusher or using a manual one.
Right.
Now, electric toothbrush again can be of two types. It's just electric battery powered, or it can be a sonic toothbrush. Now, sonic is something, the vibration frequency is high, like it's around 25K to 40K vibrations in a minute. Now, this speed of vibration resembles the vibrations which you get when you come for cleanup to your dentist, like scaling procedure, ultrasonic scaling.
Oh.
Okay, so these vibrations, sonic toothbrush, electric toothbrush, which is a type of sonic toothbrush, which is a type of electric toothbrush whose vibrations are between 25 to 40K. This can be certainly superior than manual toothbrush, but not all electric are sonic toothbrush. So while buying, if you are looking at the vibrations of bristles, that makes a great difference because it's going to vibrate well. So all the tiny little hidden things in the oral cavity, the plaque removal is better with sonic
is it okay to use sonic toothbrush twice every single day? Those vibrations are good enough for you?
Yes, those vibrations aren't what I mentioned. They every company has this limit. I told you the range 25 to 40K.
Yeah.
Between 28 to 32K is what's good for you. Yes.
Okay.
In fact, it also provides massaging effects to gum. But again, if your technique is good, even a manual toothbrush is good.
Yeah. How do you
now when I speak about
technique?
Yes, when I speak about technique, bristles should be inclined at an angle of 45 degrees.
Okay.
If we are brushing for upper teeth, toothbrush bristles should be inclined at an angle of 45 degrees to upper teeth.
Right.
Then from gums towards tooth, we should brush it vertically.
Right.
Or you can go circular motions or vertical motions, but never horizontal motion. Vertical or circular. The direction should be from gum tissue towards towards the tooth. Yes, yes. For lower teeth, it will be from down to up. When you combine these two, it becomes a circle.
Yeah.
For upper teeth, up to down, 45-degree angle. For lower teeth, from gums towards tooth. When you combine this, all sides, it becomes a circle. So it's either vertical or circular. And with respect to manual toothbrush, what I usually recommend people who have entire complement of their teeth is also to use a baby toothbrush along. Because if a person is having wisdom tooth, that to get access to that wisdom tooth with that adult toothbrush size is little larger compared to a baby toothbrush. Baby toothbrush is usually circular or very tiny. That can get better access for our last tooth. So if a person is having wisdom tooth, or if we see a lot of cavities in their last tooth, if we are examining patient and if we see everything is clean, just the last tooth are decayed, we definitely prescribe them a baby toothbrush along with your adult toothbrush. Also add baby toothbrush so that you get better access. You can clean that surface very well. So that's another.
Or it will be healthy and good to go.
Yeah. Yes. Yes.
Can you tell me more, a little bit more about your specialization?
Yes. So I'm a prosthodontist and implantologist. Now, prosthodontics is a branch which deals with providing replacement for anything that's missing. That doesn't just involve oral cavity. As in oral cavity, we could have missing tooth structure, missing gum structure that can be replaced by a prosthodontist. But we also practice maxillofacial prosthetics. As in if a patient is having missing scalp, missing eyes, missing nose, ears, digits, fingers, we actually replace these structures as well. Yes, a prosthodontist is trained for providing prosthesis, artificial prosthesis for anything that's missing in our body. Yes. And they're specially trained for that. Then there are fellowships ahead to further hone our skills in this particular aspect. And with respect to implants, that's again a fellowship course that we do along with our post-graduation, wherein implantology is a type of tooth replacement option. Currently the best tooth replacement options for a missing tooth. Yes.
So implantology. So, what would you suggest for people who are out there who want to specialize in, but they're not able to choose what field they should specialize in after their bachelor's? How would you suggest them to approach their field?
I would suggest them to shadow for some time, look at their interest areas to hone their skills. What are they good at? It should be enjoyable process. Yes. So spend some time. Even the graduation colleges have a 1-year period of internship by which a student tends to figure out in which area he's more inclined to, and then we can accordingly choose. I would always say choose branch over college. Yes, that's the primary thing. The branch will live with us forever.
Yeah.
It tends to affect how enjoyable it is for us, our quality of life. Yes, to choose branch over anything else. Yes.
Since telehealth is coming up and it's taking over the whole market. What do you think about telehealth in dentistry?
To have the beginning of conversation as in for just relief of symptoms, it's useful in dentistry, but
Right.
dentistry as such is more of action oriented.
Mm-hmm.
So it's not very effective for treatment as such, but yes, for immediate resolution of symptoms, it can be just done by certain exercises or few tests or some medications. Yes, it makes way, but for rest of the things, it's action oriented. They need to come to the clinic for getting their treatment done.
Fair enough. Yeah, I feel the same
Yes,
about physical therapy. The first few
right, right,
visits where you just want to know the history, it's still okay to have a conversation and just tell them, but then you have to be in person. The touch,
right,
the feel, the presence matters.
right.
Yeah. Can you tell me something that you want to tell the 18-year-old Monica to do or not to do?
I started prioritizing health as such like when I was 23-ish.
Mhm.
I wish I could have done it earlier. Once we start prioritizing health,
Yeah.
our quality of life improves drastically. Yes.
Right. Yeah.
But that was a phase when I wasn't very self-aware. I was just focused in academics and then going along the path. I didn't look much around. But there's a lot in life that needs to be explored. Yes. Yes.
I remember Sanjay sir connected us and uh,
Right.
met at the workshop, and then I don't think we've ever like lost the connect after that.
Right.
Something or the other, there was still the connect, and I like that. So yeah, it just reminded me how we connected, and I'm so glad that he did. Uh,
Right. I remember first time I got to know you was at Rama Sir's Academy, Excel Academy.
yeah,
I was speaking about something and then he introduced me to you. That's how I got to know you. You were my junior that time.
yeah.
Yes. And then we met for neuro-linguistic programming
Mm-hmm.
workshop here at their place. Yes.
Yeah,
And then you came to me for your
I
dental treatment. Yes.
did. I was a fan, but just I didn't know I met you at Rama sir's place. I thought it was Sanjay sir's place.
Sanjay sir had told me to just speak about physiology.
Yeah,
I had covered some topic at their institute, as in Rama Sir's Academy. Yes.
right. Yeah, I wanted to go. Oh my God, uh, this is so much of nostalgia because I wanted to start biology. I was so much interested in biology, and I used to eat sir's brains off. To be like, sir, teach me biology, teach me medicine. So I like, okay, wait, let me introduce to people who are already in medicine, and they will be
Right. Right.
better to tell you. And he used to give me
Sanjay
these.
sir has been a great
Yeah.
mentor. Yes, to a lot of us.
I
Yes.
agree. I'm here only because of that man.
Right. Right.
He also like just before he left us, I told him, sir, you have to convince my parents. I want to go to US. So like, हाँ ले आओ, मैं बात करता हूँ. Like he's always been a family, like a father to all
Yes.
of us, all of our friends.
Yes. Yes.
Just I'm just happy that he was our mentor for however long, and I'm glad that we got to know him.
Right. Right.
Yeah.
Right.
Any
Great mentor.
last piece of advice that you'd like to give to our viewers?
Respect yourself enough so that you would be consistently disciplined in life
Right.
and prioritize health because that's where life starts becoming beautiful. Yes.
That's so beautifully said. Thank you so much. Well,
Thank you.
I'll drop your links and all your information down. So if people want to connect, they want to come visit you at your clinic, they can go visit, and you have your setup in Pune. So everyone who's out there in Pune, please go visit her. She's one of the best dentists that I have come across who will sit down and actually talk to you about your problems. So please go see her today. Thank you so much for doing this session with me. I'll come meet
Thank you,
you very
Bhavna.
soon.
Yes, yes. You're coming to India. I'll meet you.
I'll meet
Yes,
you
yes.
very soon.
Yeah.
Okay.
Thank you. I was very glad to be a part of this podcast. Thank you so much.
Yeah. Thank you. Bye bye. Take care.
Bye.
Have a good
Take care. Thank you. Take care.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.